Good evening, everybody. My name is Mukul Anil Chimote, and I'm Executive Director for Astute Counseling LLC USA. We Cogent Editech Incorporation in USA. So basically, we are a career counseling academy, and I am international career counselor with more than 22 years of experience in the field of career counseling. We are a US-based academy. We are guiding the students right from 9th to PhD for all the streams. And specifically, we are providing one group solutions for all the for UG as well as PG medical studies across the globe. So basically, we are an academy of academicians, and we don't represent any universities. So basically, I'm a Art of Living teacher also. I'm associated with Art of Living since last around 20 years. I'm conducting lot of stress management workshops also. We have empaneled academicians from across 20 countries across the globe with us, and we are also into the university collaborations. Now a lot of work is going on as far as the education reforms are concerned. So you can say we are education reformist also. We are into the research collaboration, faculty upgradation programs. Now we are coming up with the twin degree programs in India, where half of the graduation in any stream you can complete in India, and half of the credit transfer, there will be a credit transfer bank, and your all the credits in the Indian education will be in the credit bank, and then that can get transferred to the US universities, and the rest of the graduation you can complete there in the US. So a lot of new things are happening, lot of collaborations are going on, so we are into it. And today's seminar, I will be speaking about I will share the screen now. So basically, today's topic is US residency program, and I will be speaking on a very unique program. There are two medical PG programs in US. One is #1 program in the world, that is USA residency program, which is a federal government funded program and completely free program with $5,000 to $10,000 per month salaries, stipends to the students, and globally accepted degrees. And second is a Master of Physician Associate program, which is a second medical PG in USA. PG is the minimum qualification to practice, and there are two medical fraternities who can practice there. One is a USA residency program, and again, second one is the physician associate program, where you can do all the specializations and you can work and you can have a license to practice in USA. Very unique program. Lot of opportunities are there for you, and it is through the non-USMLE route. So I will be speaking on this. I will be giving a detailed information regarding this, and in the end we can have a question and answer session with all of you. So basically,
sorry.
I request everybody to keep themselves muted so that no disturbance will be there. And in the end, we can you can write your questions in the chat box, or we can have a question and answer session later. So everything is focused. All the medical field is the basic principle for medical field is to serve the mankind, to serve the humanity, the society. It is a very noble profession, and knowledge is the highest. Knowledge is the highest thing. Every professionals or all the medical undergraduates who are doing the MBBS or completed their education, their main focus is to become the good doctor. And with good research exposure, with advanced studies, with good international exposure, you can really become a good professional, and you can serve the society in a better manner. And basically, as far as Indian scenario is concerned, a lot of turbulence is there as far as the medical PG admissions are concerned. Lot of reserve, few number of seats are there this year. In fact, the government has to come with the 0 percentile, means still the seats are vacant. Still the seats were vacant even after making the 0 percentile eligibility criteria, because a lot of fees is involved. less of the research, and it is very, very difficult to start the government institutions because of the reservation criteria. Around 64,000 students are there, seats are there, and around 150,000 students are applying for the 64,000 seats, including the MD, MS, and PG postgraduate diplomas. So it is a very, very difficult scenario, and anyway the cost is very, very high as far as the private sector is concerned. So good studies will make you a good professional, and all this program, all the lot of revamp is going on across the globe. Lot of development is happening. A lot of changes are there in the medical syllabus and all that, and every thing is focused towards ease in medical PG admissions. So this seminar is mainly to guide the students how they can go on a global level and become a great professional with ease into the medical PG admissions. So basically, India, USA, UK, Australia, New Zealand, and Canada. So these are the 6 best countries in the world as far as the medical education is concerned. So a lot of changes are happening, and I will be speaking on that. So every professional's main focus should be the quality of education, research exposure, upgradation, and the knowledge. So, as I told you earlier, Astute Incorporation, being a USA-based company, we have our own center in Chicago. We have a group of doctors, group of great professors, deans of Ivy League universities with us, who are guiding the students for all the career paths, specifically for the residency program and medical related programs and all that. So we started our operations 27 years back. And in India, our offices are there in Mumbai, Pune, Nagpur, Jabalpur, Vadodara, and all these regions we have the representation. So basically, in Chicago now, lot of new things are coming up with the new education policy of India now. A lot of US universities will be coming up in India with the collaboration and starting up the skill based programs, and a lot of research will be happening in India in coming days. So being a US corporation, we have our affiliated residency hospital in US in the Vineland area in New Jersey, Inspire and Cooper group of institutions and all that, and have a very good team of doctors. So basically, in this our affiliated hospitals, a lot of residency admissions are happening, and thereby we are in a complete position with whatever latest changes are there in the admission criteria, in the basically all the systems and match and soak process. Lot of changes are there are happening. So we are in a great position to evaluate personal profile of the student, match the profile of the student with the requirements, getting the chances, what will be the best chances of getting which admits are possible for the candidate, and accordingly we are in the very best position to analyze and accordingly strategize the admissions for the students. It is a lot of analytical and strategic approach required as far as the residency admissions are concerned. So basically, our quality, believe that quality education and successful career is the fundamental right of every student, irrespective of their academic credentials, irrespective of their financial credentials or status in the society. They should be able to take good education, quality education, because ultimately, if a human being is happy and qualified, he will surely contribute towards a great society. So we have received a lot of national, around 45 plus awards, national and international awards for our achievements, for our contribution in the field of education. We have received Champions of Change Award at the heads of then Vice President of Honorable Vice President of India, Shri Venkaiah Naidu ji. This was a very, very prestigious award, and given to Dr. Devras, Dr. Tushar Devras. He is a founder of this academy, and he is ex-scientist, Baba Atomic Research Center. So he started this academy 27 years back. So it was a great award. Secondly, we have also received the Pride of the Nation Award at the hands of Rajnath Singh, the Honorable Defense Minister of Maharashtra, on the very special occasion of Vijay Divas. This award was given to us. All the veterans, army veterans are there, war veterans are there. In their presence with this award, this was a very precious moment for us. We have also got Maharashtra Gaurav Award at the hands of Honorable Shri Nitin Gadkari ji, Central Minister of Transport. We have received Corporate Social Responsibility Journal Award, Excellence Award at the hands of then Chief Minister of Maharashtra, Shri Devendra Fadnavis ji. Uttar Maharashtra Ratna Puraskar. So this award was given to us beside Swargiya Lata Mangeshkar ji, and first Mahila President of India, Srimati Pratibhatai Patil ji. So this was a very prestigious award for us. Uh, Best career, more than 20 best career counselor awards. The most special is international award at the UK Parliament. In the House of Lords, we were awarded for our achievements, for our contribution, for our dedicated effort to upgrade the society. I have also received Mayor Innovation Award in Nagpur for my contribution. I have received International Iconic Achievers Award in Moscow, Russia in 2019. This was a very prestigious award given to me. Best Career Counselor of Maharashtra Award was given to me by Eminent Research Foundation. So all these awards are just, it is not about sharing. The how many times I'm sharing it, every time I'm getting inspired to work more positively for the well-being of the student, for well-being of the complete contribute towards the good education, quality education and all that. So as I shared, Dr. Donald C. Martin. So he's the ex-dean of Columbia University, the fourth ranked university in the world, Ivy League University. And he's the ex-dean of Booth School of Management, number one school of management in the world, and University of Chicago, which has produced more than 63 Nobel laureates. What must be the research quality of research there, which has given 63 Nobel laureates to the world. So he was the dean there. More than 44 years of experience in the field of this education, evaluated more than 150,000 applications. He was the admission dean. So he is in very best position to guide the student. Planning residency admission is a very strategic thing. I will be showing many information I will be sharing with you in my future slides. But this quality guidance and the team under him, great professors are there with him, which are guiding the students and planning their career ahead. So I will just give a brief information of India. Just in India, around 64,000 seats are there. Government institution, private, deemed universities, central universities are there, and Indian quota, state quotas are there. Every state has their own policies, have their own criteria. Reservation criteria are there. Around 66% reservation is there. The average cost of education in India for the PG, if you are going to the government institution, then it is okay. But as far as the private is concerned, it starts from 50 lakh to around 3 crore rupees. This is the average cost of the medical PG in India, depending on the branches. Lot of and every state has their own policies. Many states don't require the domicile and all that. So basically, main thing is that our PG is not globally valid. In India, our and it is a era of technological enhancement. Research is going on. It is a medical field is a constant process of education and upgradation. During your practice also, and a lot of doctors want to enhance their skill, get exposure to the latest technology, and for that, if you are having a globally valid degrees, so that will really help you to take the global exposure and serve the mankind in a better manner. So basically, National Medical Commission accepts USA, UK, Australia, Canada, and New Zealand license holders in India. There is no need to give national exit examination in India. Those who are into the final or those who are taking into education in the other countries like Russia, China, all that, they will have to give the national exit 1 and national exit 2. Currently, they are giving foreign medical graduate examinations. But if the students directly does his pursues his undergraduation as well as post-graduation from the USA, UK, Australia, Canada, and Great Britain is directly accepted with me. Even if you are doing the residency in USA, you can directly come with whatever specialization you perceive there, and you can start practicing in India. To national medical, these are the specially exempted countries, these 5 countries. I will just give a comparison. A lot of students in USA. USA is a #1 program in the world. So basically, basic criteria is about the ECFMG eligibility criteria. You will have to complete 3 parameters are there. One is a medical examination, and second is for clinical expertise as well as the exposure as well as the communication skill. So this criteria you will have to fulfill around 3 to 5 years, 7 years program depending on the specialization. Completely free program. USMLE Stipend Step 2 examinations are mandatory for the ECFMG criteria, and Step 3 will give you the license to practice in US after completion of your residency. So complete program is federal. It is a #1 program. As far as Canada is concerned, PR is required in Canada. Without PR, you cannot get into the residency part. New Zealand, you can give the ECFMG or now UKMLA and all that AMC examinations. You can take a general medical council's registration there, and then you can give the 1-year internship. Then you will have to give the licensing examination in the New Zealand, and then they will be giving you the general registration and then special registration and all that. These processes are there. Australia and UK. So basically, United Kingdom now PLAB is converted into the UK MLA part, and then basically it is an interview based. So after completion of your this PLAB 1, PLAB 2, now UK MLA is there. You will have to do 1 year of additional internship. Then you will get a registration at the GMC, and then you will be giving the interview, start working there, and then you will be giving interviews to various institutions and hospitals for the specialization part, post-graduation part. It is a totally, it takes a long duration, and currently lot of issues with the working licenses are there in UK and all that. So Australia, almost it is a very quality country, but almost similar guidelines and totally interview based PG selections are there. So now new medical education system from 2023 has been introduced across the globe. The total focus is on the clinical diagnosis. Any examination, or once you prepare for all this 5, 6, even in national exit examination, the new education policy which we are now implementing in India, so we are following the US education system. Very, very liberal, very, very flexible, multidisciplinary approach is there in this education system. So basically, totally it is a profile based, and how you can diagnose the patient. Clinical diagnosis is the key for success as far as the right treatment is concerned, serving the human is concerned. Diagnosis is a very, very important. So getting marks in certain examination does not prove that you are a good doctor. So if you can diagnose the patient, you can treat the patient, and clinical exposure is the key for this. And this is the new Mool mantra of the complete global education scenario now. Clinical diagnosis. So in India now, they have come with the licensing national exit examination, which will be implemented post Lok Sabha elections next year. It is totally the 95% approach is similar to the USMLE, and all the examinations. Step 1 and Step 2 national exit examination will be there. After clearing the national exit 1, they will be doing the internship part, and then they will be giving the national exit 2. Now, USMLE weightage is only 15%. The greatest blessing for Indian students and all that, a lot of emphasis is there for the clinical knowledge, in which Indian students are really good because of the great patient exposure in India. Diagnosis, clinical diagnosis is always a strong point of Indian students. And previously, the major hurdle was the USMLE Step 1, which was not a pass-fail, it was a merit-based examination. And that was a major hurdle, but it is gone now. The total weightage is for a 15% weightage USMLE step 1 and step 2 is there. 85% weightage is there for your profile, academic and non-academic profile. I will cover it. Then now UK has replaced by the UK MLA, Australian Medical Commission. That is also changed now. AMC examination you will have to give there. So clinical skills is the key for the success. Whole world after post-COVID is totally into the restructuring. Lot of changes are happening now. So basically, USA Medical PG program. Now I will come on the topic. So residency, there are two medical PG programs. Residency is the #1 program in the world. Globally accepted program, basically federal government funded program by the US. With $5,000 to $10,000 per month stipends are there for the students. You can directly come to India also. And the second program I will be speaking is Physician Associate Program, which is a pathway to the US without USMLE. You can practice in USA. So basically, first I will cover up the Physician Associate part. So Physician Associate part, many people, you should visit the aapa.org. I always believe that you should not go on any of the forums. You should always you should study on do your research on authentic websites of the government. So aapa.org is the site where you will be getting the complete information of previously it was called as physician assistant program. It is a typically master's program, masters of physician associate, and this is a medical PG program. So what exactly PA is? What exactly PA is? So 70% of the medical care in US is handled by the physician associates with all the specializations, right from the pediatrics, emergency medicine, internal medicine, family medicine, then the critical care or neurology, or you can orthopedic surgery or radiology and gynecology and gynec and obstetrics, all this specialization. So the PA can work there. New healthcare professional who will works to medical, a lot of patient interactions are there. So basically around 500 million patient interactions are there per year by the physician associates. In USA currently 1,68,300 PAs are working in US, and this profession is established in USA and Canada since 1967. And so basically great degree, around 260 PA programs are there in USA. With 2,000 hours of clinical rotations. Programs duration is at around 24 months to 27 months, around 2 to 3 academic years, and you will be graduated as a master. You will be getting the master's degree there. So basically, license to practice examination PANSE is the examination for the physician associates. So after giving the PANSE examination, you will be eligible to practice as a physician associate in the US, basically. And a lot of their criteria are there. Continuous medical education is a part of US education system. And rectification exam will be there. Recertification examination will be there after every 10 years. For you, every 10 years, you have to give the recertification examination. They will okay, how much development you have done in your field and what new knowledge you have taken up, what research you have done. All these criteria is a part, an integral part of US system. So basically, PAs are working into 5.4% in the hospital, 5.2% in the urgent care centers, 7.2% in the other specialization, and 52.2% in the outpatient department. As far as the medicine in all specializations are concerned, 21% in the primary care, 12.2% in the internal medicine subspecialties, emergency medicine, pediatric subspecialties, 30.5 in other specialization, 26.4 in surgical subspecialties, 4.7 in the general thing. So as far as the US News and World Report 2021, best job in the US for the physician associate. It is the #1 job around 100 jobs, it was listed #1 job in the US. Fastest growing job, it was ranked 5th in almost 100 jobs. They had compared 100 different fields and the same fields basically, and in that it is a 5th ranked job. So best healthcare job listed in US News and World Report 2021. So all these reports are published by the aapa.org. You can take a reference from that. Basically, around 175 universities are there where the students can apply for the physician associate program, typically 24 to 36 months of program. So the starting salaries for the physician associates are there basically from $1,25,000 to $1,50,000 per year. Means average 1 crore rupees per year. It is better than NDMS in India actually. So it very high skills, very prestigious job, and very wrong assumptions were there by the people. Ki it is a substandard and everything and all that. It is very prestigious job. Almost all the specializations are there, and basically, what is the eligibility? Now we have to think that what is the eligibility. So basically, what happens in India if you are a MBBS and you have done the anatomy, physio, 9 different subjects are there. So basically, you will have to complete the prerequisite part of it. Matching of the prerequisites key for the in USA pre-medical and medical is the part. There is always a pre-PA, pre-physiotherapy, pre-dental, and then the dental will come, or pre-medical, then the medical will come, or pre-PA and then the PA will come. So basically, your prerequisites and the global applications are coming there. So they have to evaluate whether what is the standard of your education, basically. And depending on that, you will have to do the prerequisites part. It is a clinic prerequisites matching is crucial for getting very competitive program. Each program has only 35 to 40 seats, and around for international students and all that is 175. Very competitive. So matching of your prerequisites is the key for success, and you should have a proper clinical exposure also in the patient care for from 250 hours to 2000 hours, depending on the which program you are going, depending on the various requirements. Each university has different requirements. If you will go on the aapa.org, you can refer to the programs available there. You will get the complete information for that. So basically, MBBS in USA, now people say, why should I am an MBBS doctor, and even the BAMS doctor or BDS and BHMS and BPHD or occupational therapists are also doing, or somebody from the biotechnology or biology field is also doing this. So let me clarify. US system is a very flexible system where anybody can do anything. For example, Dr. David Kaufman, who is the #1 infection specialist in the New Jersey region in the Inspire and Cooper group there. So basically, previously he's a humanities graduate. So it is not that if I am into the biology and if I want to go for a MD in USA for medical, I can go there. Engineers can also become doctors in US. It is all about credits. They say they evaluate their degree and they say that these are the program requirements and you will have to complete this much of prerequisites. Then we are ready to take you. That's why there is a concept of... So please mute yourself, basically. So all these things are there. So it is not that don't feel why other people are permitted there. It is a system. It is a very flexible system. It is all about prerequisites. Even the BSc student can go for an MD program in USA. Be clear about it. It is not that he cannot. He will give the MCAT examination. He will do the prerequisites required, and then he can go into, after clearing the MCAT, he will go to the MD program. After that, he can do the residency also. So all this eligibility, all this people can go there. So people from biomedical, biotechnology, bioinformatics field can also practice allopathy in USA. That is a great thing. And currently there is nobody in India who is doing this program. So we are the first one to launch this program in India. Great research is behind this. Lot of hard work we have done for this, and great opportunities are there. So basically, these are the prerequisites. So anatomy, physiology, biochemistry, microbiology, chemistry, organic chemistry, genetics, medical terminology, psychology, statistics, healthcare experience. So if you have many people who have completed their MBBS long back, they feel a lot of trouble as far as the residency admits are concerned. So US system always believes that if I will give the 12th examination for organic chemistry now, it will be very difficult for me. I forgot what chemistry was there in for me in the 12th standard and all that. So more than 5 years of gap. So, and second is the GPA. In USA, 4 band scale is there, and always the students are getting 3.6 GPA or 3.7 GPA is a common GPA in the US. So what they do the WS evaluation of your transcripts, and they convert your percentage into the US GPA. So in our system, the toppers are around 75%, 78% are the toppers. MSc or for MBBS or for any other course, what is the percentage of the topper? So if you will convert that into the US GPA, it will come into 3.1 and all that. And there are different level of courses. Each subject has a credit value. So anatomy 100 level, 200 level, 300 level there is. So if the value of anatomy is 3 credits, so that means 3 hours per semester, per week per semester is the required period for that completing the subject. So that much of prerequisites you will have to complete with 3 point, and these prerequisites can be completed in India also. So during your graduation or after completion of your graduation, you can do it from the US universities offline, or you can do it in the online mode from the India. You have to score good GPA. For great scholarships are available for the students, 3.5 GPA. So GRE, it is not mandatory, but giving the US system has 50% weightage on the academic profile, 25% weightage is there for your non-academic profile, and 25% weightage is there for your analytical ability and all that. So 25%, if you get good marks in GRE and all that, it is a common examination. Even the commerce students are giving the GRE examination there. So a lot of scope is there for getting the scholarship. Now, it is not mandatory for all the institutions, but it is always advised to go with the GRE. A TOEFL examination, you should score around 100 marks. Then these are the optional examination like CASPER and PA-CAT. These are the optional examinations, that these are not mandatory. But giving this will open up huge opportunities for you. And completion of your complete WS evaluation and completion of your prerequisites and getting good GPA, 3.5 GPA in that. So that, and interview trainings are there, PA interviews are there. So when we apply, we match credit by credit the program requirement of that university, and then we train the students for the interviews and all that, and then based on that the PA admissions are there. Very, very competitive admissions are there. If you have a fantastic profile, even without prerequisites also you can go into the universities. But it should have a topmost merit level. Your profile should be very, very high profile. So all the specializations like from cardiology, critical care, endocrinology, gastroenterology, hematology, oncology, infectious disease, nephrology, neurology, pulmonology, rheumatology, pediatrics, internal medicine, family medicine, all these specializations are available. Surgical subspecialties like cardiovascular, cardiothoracic surgery, bariatric surgery, colon and rectal surgery, general surgery, neurosurgery, oncology surgery, orthopedic surgery, urology, transplant surgery, pain management, OBS, and then ophthalmology, pain management, dermat, genetics. All these fields are available for you. So you can choose amongst these programs. The highlight of the PA program is that it is amongst the top 3 professions in US, very high job opportunities, non-cap H1B visa, speedier green card processing. This is the high point of USA. If you want to settle down in US, you have a vision of going to the US, you don't want to go through the USMLE and longer route, you can go there. Even after 12 standards, there are integrated programs are also there for the students. Within 6 years, they can start practicing in US. Very, very prestigious jobs. Even after, if you want to build up your profile, you have completed your MBBS long back, you can pursue the PA. Simultaneously, you give the USMLE step 1, step 2, improve your profile and go into the residency. After this, you can do the PhD programs. After that, you can give the lot of specializations are available for you. So, great prerequisites can be completed. These are the high points. Around 1 crore rupees salary per year is the starting. Now, main thing is that optional, since you are under the same courses, optional practical training is available for you for 3 years. Means during your course, you can work as a student, you can earn your living. You can indulge into the from day one into the research activity, so that you can get the research assistantship, you can go into the project teacher assistantship. Lot of scholarship options will be there for you if you are really serious about the profile and all that. So you can have a student jobs to earn your living also, and after that optional practical trainings for 3 years. So lot of loans are available, education loans are available to complete this program. Average cost of this program is around $30,000 to $50,000 per year is the fees for this. So based on that, even the US banks, if you have some guarantors there, so very, very cheaper rate the education finances are available at 3 to 4% per annum. And easily you can repay within a 1 year's time or 1.5 years time, you can repay the loan to the banks. Great job opportunities. Lot of scholarships are there based on your profile and all that. So prerequisites can be completed in India online through accredited US universities at a very, very affordable cost also. This option is also available. So we have a special batch where launching first year full-time prerequisites can be done in India. Average cost of prerequisites is around $380 to $500 per credit. Around 32 credits are there. And after that, give the PA interviews and all that, and you can go there. Great. So you can save around $30,000 to $40,000 going to the US universities. So for the students who are into the undergraduation, they can start their profile build up and completion of the credits during prerequisites during their graduation. 1122 credits and all that. Now we have proposed to the UGC. Okay, we are coming up with the pre-medical and pre-PA in India products in India. Many deemed universities are coming out with this idea. So it will come under the UGC where the prerequisites can be completed into India. We are really working into that. Even 5 years integrated program is there where you can directly fly down to the US for 5 years. You can complete your pre-PA and PA from the US universities directly. No need to take your prerequisites in India for 5 years. You go there and have a license as a PA there. So generally the Jan intake is there, March is the major intake, and August intake is there. So depending on the cycle, you should plan your prerequisites and all that. And depending on that, we can apply to the various universities. So great program. Surely think about it. Great opportunity to settle down in US. And comparatively, it is a very, very competitive. It is very, very difficult program. Very, very competitive program to get the admissions and all that. So really, you need to work hard. Now I will come on to the residency program, medical PG program in the #1 program in the USA, in the world, you can say. Basically free program, free education, and $5,000 to $10,000 per month is the stipend for that. Great opportunities to work there, to settle down in US. And for even if you want to come back to India, you can come with a great professional skills, with great research exposure. You can serve your country in a better manner. Lot of basic salaries around 2 to 2.5 crores is the basic salary packages for the physicians there per year. Great program. So in USA, PG is the lowest qualification to practice in USA. But for means all the students who are into the undergraduate program in USA, they cannot practice. In India, the MBBS can practice till now there was no licensing examination in India. Immediately after completion of the final year, you were going into the internship. After that, you will be doing the practice. And if you want to do the PG, you can go for PG. But in USA, PG is the minimum qualification to practice. Undergraduates cannot practice in USA. So basically, still 2,000 seats were vacant, are vacant every year from last 5 years. Around 2,000 seats are vacant per year. I will be showing you the why. Because of the lack of analytical and strategic approach as far as the admissions are concerned. So great opportunity for Indian students, internal students, even the graduate Indian students who are pursuing their medical education from abroad, countries like Russia, China, non-English speaking, they are facing huge troubles. Even 20,000 students from Ukraine came back to India. They don't have any future. They are stuck up. So US can be a great pathway for you, because anyways, if you are coming back to India, you cannot apply to the state government seats in the India. In most of the states, you are not allowed to apply for that. So you will be applying to the 50% seats. You will be applying to the deemed universities where the cost of education is very, very high, tremendously high. So basically, you have to think about US can provide you great opportunity where whatever expenses, many students have done the MBBS from deemed universities in India by paying 20 lakhs, 22 lakhs, above 15 lakh fees per year from the private institutions and all that. Already they have spent 1 crore rupees in India for their graduation, from 75 lakhs to 1.25 crores. For practice also, they will require the money. So residency program can give you a great opportunity where whatever money your parents have spent on your education, you can repay that loan. You can acquire best of the professional skills. You can have lot of capital investment with you. You work there for 4-5 years, and then you come back to India with all the knowledge and all the money, and give a service to the our country. So that is a great program. And now the USMLE weightage is only 10 to 15% from 26 January 2020. So USMLE is a licensing examination. See, licensing examination and PG examination are different. NEET PG examination is different. And licensing examination is that all the undergraduates in USA, unless they have a license to practice, they cannot treat the patient there. Everybody wants to go. It is compulsory for them to go to the PG. So if you will see the results of USMLE, it is about 90%. 90%, their main focus is not failing the student. They are just monitoring your, evaluating your skills, whether you have skill set to treat the American patients, citizen. That is their main motto. So it is not about failing the students and all that. So if you will go to the usmle.org site, and if you will see the results for last 5 years, you will get the complete key, what is the percentage of passing. So basically, now USA has 6 different pathways to enter. If you will go on to the ecfmg.org, you will visit that site and go to the 6 medical pathways. So many students, all the Indian students generally go for the. Hello. Am I audible?
Yes.
Audible, na? So basically, medical students in India, they go through the pathway 1. So what is this pathway 1? Already licensed to practice medicine in another country. This is a pathway 1. Now many students, Indian students specifically, who are stuck up in foreign countries, so they should check it up whether, so what they will have to do, because the countries like China or Philippines and all these countries were not issuing the license to practice in that country. So they were coming up with the degrees here, and they were giving the foreign medical graduate examination in India, and they used to take 1 year of clinical rotation and then getting the license. So if for them the pathway 1 will be there, but many colleges, many countries, you should check up whether your college is under the pathway 3. So the ECFMG has declared 6 different pathways Where the third pathway is that the medical school accredited by the agency recognized by the World Federation of Medical Education. So if your college name is there in that pathway 3, so there is no need to give the foreign medical graduate examination in India. You can, after completion of your graduation there, you can directly go to the residency after clearing the criteria. So you should always check up these 6 different pathways are there. है ना? So you go there कि an evaluation of clinical patient encounters by licensed physician. This is the 6th pathway. So these are the 6 pathways. So depending on that, this pathway has to be, you need to choose the pathway for the residency in US. Apply to the ECFMG, and 6 pathway application should be there. So now step 1 is only pass and fail. Now, step 1 examination is only pass and fail. The major problem for India was that, Indian students was that, it was the major hurdle because student used to give it in the 3rd year of MBBS before completion of their internship. They used to clear the examination. But in USA, there is a restriction on the USMLE. If you clear the USMLE with lower score, if you pass the examination, you cannot repeat it for 7 years. So student previously, when the complete weightage was there, till 26 Jan 2022, residency, lot of your seniors or your batchmates must be settled down in US. They must be sharing lot of experience with you. But I am telling you, the complete system is changed now. Now, USMLE weightage is 15%. Now, even if you are passing the examination with lower score, it is only displayed as pass and fail. So that hurdle is gone now. And the passing rate is more than 90%. Students are passing the examination. So once you clear the examination, you cannot repeat it for 7 years. This was the criteria, but now it is pass and fail. Now step 2 CS is scrapped. Previously, the student used to fly down to US. They were given the complete clinical scenario and patient scenario. 12 different cases were given to them, and the juries used to observe them. They were diagnosed. They used to diagnose. They used to speak to the student, to the patient, and they used to evaluate the juries. It was a very, very difficult thing for the students. So now it is scrapped. It is no longer required for the US admissions. Now step 2 CK has maximum weightage as far as the USMLE is concerned. And Indian students, specifically Indian students, are very good in step 2 CK. You can give either of the examination at any time. You can give first the CK, then the first step 1 and all that. But Indian students are really good at CK because they have huge patient exposure. It is a strength of Indians. So basically, now USMLE exam changes are there. Now I already mentioned about the pathways for going into the US. So the countries and the institutions, those who are not into the pathway 3, now they are facing major challenges. Neither the students, because of the new National Medical Commission law, can come back to India. Neither they are able to apply for the pathway 3. So those countries are always good who are providing the license to practice. It is a mandatory thing now. So few tips. You are free to take your decision, but as far as the experience is concerned of the faculties and all that, we have observed that you should always give the examination after the internship. Never ever give the USMLE after step 1 should be given at least after 6 months of your clinical rotation experience, and after that you should give the step 1 examination. And step 2 examination should be given clinical rotation experience. So lot of virtual as well as clinical rotations. Now hospital rotation is very, very critical part of the US education system. You should get sensitized to the clinical culture in the US. So basically, there are physical rotations are also valid. At least you should have a 2 months after clearing step 1. You can go for a 2 months of clinical rotations there, physical clinical rotations. Take the letter of recommendation, work under the senior professors, and then after you should give the CK examination. This is the best scenario. And secondly, virtual clinical rotations are also available. So during your undergraduation or during, you can take one month of clinical rotations there online. So that is very good as far as your profile build-up is concerned. So all this is valid, and you can surely take exposure. It is very, very crucial as far as the residency admits and success is concerned. So 15 to 20, rest the profile is most critical. Now USMLE 15 to 20% weightage is there. So profile is most critical. And the major thing previously, this is the scenario, okay, USMLE was 194, now it is pass and fail now. And USMLE step 2 is around 209 marks in the passing. So you should score at around 250 marks plus for the step 2. It is very, very crucial for that. And USMLE step 3, after completing USMLE step 1 and step 2, only you can appear for the step 3 examination. So major is the profile built up, and profile built up requires time. It is not a thing in urgency you are building up and you are applying in hurry to the universities and the programs and all that. You have never taken up some research and all that. So never do these things. Always give ample time for your profile built up. I always advise students to start early during your undergraduation to take up the profile built up activities. So what this is academic profile? It's research projects. Now research means, see, lot of people have lot of confusion regarding the research part. Now you are an undergraduate student. They don't expect that you should have the knowledge of a residency. Whatever subjects you are taking during your undergraduation, what understanding of that subject is there with you? So lot of colleges are having lot of data and all that. So after taking the permission of the ethical committee and all that, you can surely do some research projects, involve into the ICMR projects and all that. Even if if 15 people are there with hypertension and all that, and you are giving them the olmesartan or various medications there on that, you are maintaining their complete data. And now they joined some program like Art of Living and all these programs. They are doing the regular meditation or kriya and all that. And after that, you are again taking their readings and all that, and you are finding the difference between the after meditation and all these practices, what is happening, what is the analysis of the all these my 15 patients. And those students, those patients who are not doing this, and those patients who are doing this, following this. So what exactly is the difference between this? You can visit certain portals also where research, and you can write the review articles. Lot of conferences are happening. You go on the pathology part and all that. Now USMLE has 50% pathology statement. Now anatomy, then biochemistry, physiology, these are the main components of the USMLE. So how many conferences have you attended on pathology? So all this thing, it is a continuous learning is the thing. Now environmental, doing something for juvenile diabetes, tree plantation activity, plastic use awareness program, blood donation program, organ donation pledge, doing the Rotary activities. All these are so much important for building a profile. You should have the YouTube creation for yourself. This is the era of videos and all that. Clinical rotations, letter of recommendation from the Indian faculties as well as the US faculties. If somebody junior professor giving you the letter of recommendation, lot of students, I came across so much of counseling, and they are so overconfident. If we have so much of qualification and we have so much of this and that, and we have recommendation from this, we can manage this. People are purchasing the letter of recommendation. That does not have any value as far as the residency. Immediately,
एक बेटा तुम्हाला डोसा म्हणतो ना, डोसा बनवलेला.
Confident about this. Program selection is very, very critical. Why 2000 seats are vacant? Where to apply? Not every student can get into the AIMS or Zipmer Pondicherry. You will have to apply according to your profile in Indian universities also. So similarly in USA, more than 40,000 programs are there, and you are applying to only 50 programs there. So how you can get the admission in US? Residency interviews, documentation. We are very, very, Indians are brilliant in communication as far as patient, but very, very bad in documentation, in presentation. Residency interviews. So basically, and match and soap process, where to apply. The person who has designed the match and soap process, he is a Nobel laureate. There are 52 different parameters on which the residency admission happens. So start with the profile activity, built up activity. Getting good marks in USMLE, because the first shortlisting, when you will complete your step 1, step 2, and after getting the ECFMG certification of eligibility and all that, then you will be applying to the various match. You will register yourself for the ERAS process, and the university will call you based for the interviews based on your profile. The first shortlisting of the university happens on the profile. If Washington St. Louis University is there, and there are around, suppose 1000 applications or 500 applications are there, they will call 75 students or 100 students on it based on the profile. So program selection, robust documentation, proper your present YouTube video creations, your profile, your research, your publications, your review articles, and your strategies for the match and so. This is very, very important for getting into the residency. The match is very, very critical thing. 52 different parameters. The students generally, you have to register for the R3 system there. Register ranking there, and then the result. This is the R3 system of the match. So you will apply to the ERAS, then you will apply to the various programs. Various programs will call you for the interviews. Then they will rank you, and similarly the student will rank you, the programs. So preparation of your rank order list is a very, very critical thing. It is a very, very strategic thing. So these are the some datas which I will like to share with you. You cannot go into the clinical branches. Indian students are not getting into the surgery branch and all that. All this is a wrong information. I will always say that go to the government data. You go there and have your self research. So basically in 2020, around 37,256 positions were there, and 40,000 applicants were there. In India, for 64,000 seats, 1,50,000 applicants are there with 0% tax and 66% reservation system. In USA, for 37,000 programs, they have 40,000 applications, and nearly 94.6% students got to the PG-1 positions there. See this. Now, if you will go to this, in 2021 positions, around 38,106 programs were there, and 42,508 active applications were there. So if you will see to the positions, so around again you will see 94.8% PGY1 positions were filled up. This is the latest match of 2023 March results are there. So basically this year the seats increased to 40,375. And out of for that 42,952 certified applications were there. If you will go on to the international medical graduates match, Hannah, this is so around 60% of the international students got the residency. It is a very, very high percentage. All this is the data. This is a calendar for 2024 match, which is you can visit there. The 15th September it starts, and then it is a complete calendar. Is every year it is published, and depending on this, we need to take the further steps for registration and all that and all that. So process. So if you are not getting the match, so process is very, very critical. So in 45 minutes, morning 6, 9, 12, 3 or 9, 12, 3, 6, 3 hours time, you will have to put up the 45 programs, non-match programs into that, out of the available programs and that. Very, very critical. So you can get, if you like spot rounds in India, stray vacancy rounds in India. Very strategic thing. So I will show certain graphs ki surgical and clinical branches are also possible. So this is the chart of 2022 match. In this, if you will see the number of how many participants. So if you will see ki senior students of US MD graduates were 19,902. And here, if you will see the international medical graduates, non-US citizens, students, graduates of international medical school, 7,864 students applied for the program. This is the complete data published there. Now, these are the positions. These are the positions were filled. If you will see, these are the highest branches by the international medical graduates. Number of applicants and position in 2000 residency match. In this, you go to the non-US international medical graduate. If you will see, so these are the branches available. So even in neurology, even in surgery, there are good number of students who have got the positions there. See this. These are the top 5 branches and all that. Everything is given here. Internal medicine, around 2,431 students got the internal medicine. Total 4,200 students applied for the internal medicine there. The complete data is available for you. Neurology, pediatrics, pathology, orthopedic surgery, plastic surgery, everything is given there. Now this is a graph. Now here the blue linings is a match and the green represent the non-match. Even you see this, if you will go to the this surgery, general surgery part, so you will see that the students, even with 250 and above score, has not got the match, but with lower scores, around 250 has got the general surgery also. You see this internal medicine. So here the internal medicine, around 235 to 40 has got the internal medicine marks. Okay. See, great. So all this, these are the data: plastic surgery, obstetrics and gynecology, everything is given there. This is the SOAP data. Around this was the 1652 were vacant in 2019, even after the SOAP. So now this year around 2,600 seats were vacant in the US, with more than 550 surgical seats were there. So now they have added additional 4th round for the SOAP for filling up the remaining seats and all that. But that is a great opportunity. With proper approach, you can surely get the residency there. So never give USMLE during your undergraduation. Always give with enough clinical exposure after the internship. Go to the US, take proper exposure, and then give the step 2 CK, score good marks, build up your academic, non-academic profile, and with proper strategies, program selections, good interviews, you can start the residency. So we have mentoring programs at different levels. We have customized plannings for the every student, different levels. So as per his requirement, his current academic status, we can suggest a mentoring programs for them where the US faculties and residency experts will groom them to get into the residency. They will handle their complete process also. We are not trainers, we are mentors, we are counselors, we are strategists. This is the basic difference between us. So these are the credentials. If you want to check your credentials of your college, whether it is registered with the World Federation for Medical Education and all that, so you can check with VEDOMS, you can go on the sponsors and you can watch for a sponsor's note, ECFMG note on the sponsor's note. So you can check out there. These are the fee, around $1,000 is the fees with some this all this if you are taking from other than US and in country like prometric centers and all that. So some charges, additional charges are there for that, for the application and everything. Everything is given on the USMLE and ECFMG sites. So you can visit surely. So generally, if some students are planning for their undergraduation and PG in US, so after 12th, you can directly go for a pre-medical program. Then you will give the MCAT examination. Then you will give the MD. You will either go to the MD or DO. And after completion of DO or MD, you can give the USMLE step 1, step 2, and DO will be giving the complex examination. And after that, they will give the USMLE, they will complete their MD and all that. And after that, they will completion, they will be giving the licensing examinations and they will go for the residency. After giving USMLE step 1, step 2, and complex step 1 and step 2 for the DOs. Or third pathway is that they can go for a pre-medical or pre-PA, and then they can give the GRE and go for the PA program there and start practicing there. So you should register yourself at the early stage of ECFMG on the ECFMG portal, and whatever academic credentials are there for validation of that, you should go on the EPIC portal. EPIC portal is there and you can put your credentials there. So these are the official websites like nrmp.org, ecfmg.org, usmle.org, nbme.org, nmc.org, and aapa.org. You should go on these sites for complete information. All the informations are given on this. It should not be opinion based thing. It should be a self research is very much involved into that. Those who are the senior physicians and completed their MBBS long back, so chances of getting residency for them is difficult. But still, if continuous education is there, you can give the step 1, step 2, as well as step 3 examination. Build up a good profile and then go for the residency program, or you can apply for the long-term fellowship program, NRMP fellowship programs there, which are free also. So all these things are there. So our offices are there in Chicago, Mumbai, Pune, and Nagpur. Basically, these are our websites. AstutePromo.com is our YouTube channel and all that. We can have one-to-one session for all the students. We can have with their parents and all that, with the professionals. We will like to evaluate their profile, and according to that, we will surely like to guide you. So if you are interested, you can register my appointments on the portal, as well as on these numbers. You can contact Pranali, Dr. Varsha, as well as on these numbers and our team members, and you can get into the touch online. Also, you can book our appointment, and we can have one-to-one session. You can also visit physically to our offices and all that. So thank you very much for this. That is all. So I hope the information was good. I tried to cover it fast because of attention span is very less nowadays. That's why a lot of information is there, but we need to complete it into 45 minutes or 60 minutes of time. So I will surely like to take up some questions. So just a minute. Varsha ji, can you please read out the questions, or Pranali?
Yes.
Please.
You can unmute and ask the questions.
You can also, Venkatesh ji, please ask.
Yes, sir. Good evening,
Thank
sir.
you,
Actually,
sir. It was good overview with the
Hel-
key points emphasized. Thanks a lot, much appreciated. Namaste. बस ये
Thank you.
क्वेश्चन तो नहीं है.
Yes, Venkatesh, yes.
yes, sir. Good evening, sir.
Good
So,
evening. Yes.
yeah, actually, I'm just a graduate from the Avlan University School of Medicine from Netherlands. But the thing is, like, I have done only my basic science program, which is only MD program. So, but and then I'm just stuck over there for like 2 years. It's been more than 2 years. So right now, I'm just preparing for my USMLE Step 1 examination. And I haven't done my clinical rotations yet.
What?
So like I haven't done my clinical rotations. So it's
Yeah.
basically it's like a basic science and clinical rotations over there. So then it's like completing the MBBS degree in India, as you just mentioned it. So like what is the best option for me like to proceed from here? Like so
For you, basically, I feel that clinical rotation is very, very integral part if you want to get success in the
yeah.
USMLE into the residency. So
Yes, sir.
first
But
thing
the
is that
thing,
you check up on the ECFMG whether your college is valid for the pathway 3. That is
yes.
very, very important. Secondly, you should check up that you can take up certain internship, private internship with the doctors and all that. One way is that you can give the foreign medical graduate examination with the NOC, proper NOC from the board, Indian National Medical Commission, and take up the clinical rotations and then go there. Or if ECFMG pathway 3 is available, then you can prepare for the USMLE step 1, step 2. You can take the clinical rotations in US. You would start taking virtual clinical rotation. In addition, you take the physical clinical rotations. You can work with the doctors here in India to build up your clinical knowledge. Because without that, it will be very difficult for you. But for you, PA can be a great program. Because it is a
yes, sir.
non-USMLE route to it. It is a great program. It is not a free program, but it is really a very, very great program. I will surely like to suggest it for you because you don't have a clinical exposure at now. So what you can do, you can build up your profile or you can start with the prerequisites, get your transcript evaluated by WES. You can start with 1 or 2 credits here in India, and then you can go for a PA program in the US, and then simultaneously you can, with having a clinical exposure during your PA and all that, do the research activities and all that. So your profile will get upgraded. And then if you want to go for simultaneously, the PA license will be there. You will be secured. After that, you can do the PhDs and everything everything. You can work as a PA. Or since you are an MD graduate, you can also take up the residency. That is also
Yes, sir.
available for you. So you will have both in your hand. So
So
rather
like I
than
mean,
wasting your time here and all that, you can enter into that. But it is not a free program.
okay. Yeah. Thank you, sir.
And so you share your profile with what are your scores and everything you should share with us. So
Yes,
we
sir.
will
Like I mean, right
evaluate.
now I'm just giving my NBME exam right now. So
Yeah.
once I pass the NBME, then I'm going to give my step 1 exam, and then I'm trying to go for the US for my clinical rotations only. So, but I'm just kind of stuck
But
over here for
with
2 years.
USMLE
So
preparation,
that's
you
why.
should have with proper patient exposure, then it will be the great success will be there. And also you should go to the NBME and you should give the mock test also to evaluate your results.
Yes,
Because
sir. But
if you will
according to
get
my
lesser mark in the step 2 now, lesser mark in step 2, you will stuck up. You will
yes,
not be in a position to repeat it for 7 years. So you should take up the proper clinical rotations. You start with the virtual clinical rotations from the US also you can start. So that will also help you for the ECF for the USMLE part.
okay. So without USMLE, I can start the virtual clinical rotations in the US
Yeah.
without
Virtual
giving
clinical
the
rotation
USMLE.
anybody can take. Okay.
Oh, okay. Yeah. Thank you, sir.
And letter of recommendations will also be very, very integral, important part of the residency and all. So how you are going to get the letter of recommendation? Only you will be having some
Yeah.
professor from Netherlands who is going to give you from India. So you have some senior
Mhm.
physicians and all that who should give a recommendation form with whom you are working and all that. So have one-to-one meeting with me. Send your profile so
Okay.
that we can discuss in detail everything. We will evaluate with the US team your profile and then we will give exact advice to you.
Okay, sure. Thank you, sir.
Thank you.
One question is there. Sir, can you give me detailed information about soap?
So basically, you go on the nrmp.org. So after the nrmp.org, complete information is given about the soap. So generally, match process. If you are applying to certain, suppose 200 programs you are applying there, and you are not getting the match. So after that, whatever the seats are there, like remaining seats will be there into the soap. So you can apply to the non-matched programs in the soap. You can, and there 4 rounds are there in the soap. Supplementary optional rounds are there, where in a single day 4 rounds will be there. You can apply to the 45 programs during that, and non-matched programs. So a lot of success is there. If proper strategically, if we can handle the soap process, you can surely get that. Soap is very, very crucial. So it is like a supplementary optional rounds after the match rounds. Yes. And go on to nrmp.org. The complete details of the soap is provided there.
One more
Yes.
question. Sir, please elaborate on post 10 years MD dermatology options.
Hello. Yes.
Please elaborate on post 10 years MD dermatology options.
Acha, means you have done 10 years of, you have already completed dermatology in India?
Yes. Already
So,
10 years before.
So 10 years before. So 2-3 options are there. You should firstly share your profile. Second is that for you, I will suggest, if you want to go for residency, you need to clear all the 3 steps. And step 2 will not be enough for you. You have to clear all the 3 steps with very good marks. You should have a very good research profile with you. You need to build up your profile. Another thing is that you can apply to the fellowship programs there. So for a fellowship also, I will suggest you to give step 1 and step 2, and then enter into the NRMP National Residency Match Process Fellowship programs. So for that also, you should have a very good, great profile. Already you are an MD and practicing since less than 10 years, but research is very, very integral part of it. So that are the options. Third option is there ki you can go into the PA program, no issues at all. And in the PA, you can do the desired specializations and all that, and you can settle down in US. Fourth is you can go for a short-term fellowship programs in US for the skill upgradation. So we are sending a lot of doctors to different hospitals and all that for 3 months of short-term fellowships there. So they go there, they work there with the professionals there, and they enhance their skill. So after 3 months or 6 months of time, they come back. So all these options are there. So one is for residency, it is not impossible, but it is difficult. So advice to give step 1, step 2, step 3. Do build up your great profile, or either you give the step 1, step 2, apply for the long-term fellowship programs. So after that, during the fellowship also, you can get into the residency. On the recommendations also of the faculties, you can get into the residency part. So all this or short-term fellowship or PA program to enter into the US. If you want to settle down in US and guaranteed options there, you go to the PA. It is better than MDMS in India. Yes. Yes. Any other questions? Yes, please. Varsha ji. Hello.
Yes. AMC is better or USMLE?
See, Australia is also a great country, but after number 1 is country is the US only. Almost similar approach, but AMC has one thing. It is basically more of a Britain kind of system. So there it is totally based on the interview based selection is there. It is not like whether you will be getting the chance to give your rank order list, and the institution will give their rank order list. It is a one-way thing. So you will clear the AMC and then do the internship, take the registration, and then based on the interview based your selection will be there, and then the further pathway. Australia is a great country, but US is best. Very, very flexible system. US is very, very flexible. So more number of students are always will prefer go. Most of the global personality professionals are more attracted toward the US part. And then money also, a lot of money is there in US. Great money, and physicians are always a priority, and physicians also for the green cards and all that.
Sir, I'm a diploma ENT with 8 years of experience.
Yeah.
Can I do the fellowship?
Yes, you can do the short-term fellowships. You can also give the go for the long-term fellowship. MBBS split diploma in ENT is there. So need to clear the USMLE part. You should give the USMLE statements. Only on step 1 also you can apply for the NRMP fellowship programs, but it is always good to give step 2. And you start works, do some research and other academic and non-academic profile builder. Then it is possible. It is, you can surely go for that. Yes.
Sir,
Yeah.
I'm from Philippines. I just graduated in 2021 and I
Yeah.
cleared FMGE this attempt. I'm
Very good.
currently waiting for internship. Most probably it will start in a couple of weeks.
Yeah.
So I just want to pursue my career in US for USMLE steps.
So great opportunity. You can focus on 2025 intake. So
Okay.
2025 September will be an ideal way for ideal period for you to go for the residency program. Apply for the residency program. Till then, along with your clinical rotation, you start with the academic and non-academic profile built up. Do some research, have some publications. You can have one-to-one meeting for you. You can join our mentoring program, and everything is there. So and then clear next 2024 means around September next year, you can give the step 1 examination after evaluating your proper mock results. After having 6 months of exposure in India, clinical, you prepare, you give the means I am taking into consideration ki now you will start the rotation, and in mid 24 you will complete your 6 months of rotation at least.
Yes, doctor.
After that, you give the step 1 examination. Then after completion of internship in around December or January, you fly down to the US for the clinical rotations, physical clinical rotation. You can also take virtual, but physically always good. And then give the step 2 examination.
So since I'm
until then, you can come up with 2 major research projects, one group research project, and all that. Everything can be done. It is possible. And then 2025, you can surely apply for that. Another pathway, if you don't want to go for residency, then you can go for a PA program also. For that, you start with the prerequisites during your this internship. Start with 2 subjects, score good marks from the US, and then do the GRE. And 2025 March, you can fly down, or Jan 2025 Jan or March, you can fly down to the US for the PA program. These are the options for you. Great. Master of Public Health, MBA Healthcare Management are the non-clinical things in US. If you really want to have a great jobs and all that, you should always enter into the clinical things. So many, it is possible. It is a right time. Don't be late, because you have only 16 months in your hand to complete all the parameters and all that, to build up a profile. That you should start from now.
Okay, doctor. Thank you.
So you connect with Pranali and all these numbers. You book one-to-one appointment, send your profile, and we will evaluate, and we can have one-to-one meeting in presence of your parents. Thank you.
I'm medical graduate from Andhra Pradesh, India. Is it good to do PA in USA or USMLE?
See, it all depends. Basically, I always say that residency is a #1 program in the US. Residency is #1 program in the US, but PA is very, very prestigious. It is really very, very prestigious thing. PA is a very, very prestigious profession. It gives you great opportunities in the USA, and to enter into the US, it is amongst the top professions in US. So what happens if you are not comfortable with the
Your voice is not coming
into the residence, that is
Hello?
also very, very important.
Your
Because
voice is not
if your
coming.
profile is, how is your profile? whether it is good for residency or not. This evaluation is very important. That does not mean that PA is an inferior program. Don't be under this. It is very competitive program. But non-USMLE route, you can complete the prerequisites, enter into the US, and have a great profession ahead. And still, your pathway for residency is always open for. That is not an end for that. For PA program, we need to give minimum how many exams? For PA program, basically, you need to complete one student from Ahmedabad currently. He was from the which BJ Medical College, Ahmedabad, totally meritorious students and all. So without prerequisites, he got the admission. But it is not the case. On an average, out of 100, only one case or two cases are possible for this. So basically, prerequisites, subject-wise, one subject at a time or two subject at a time you can start with, and you can give the complete the assignments, give the subjects within 8 months, 6 to 8 months. You can complete with most of your prerequisites, and then GRE. I advise you to give GRE and TOEFL exam. TOEFL is mandatory for you. GRE you should always give because lot of scholarship and great universities will be available for you. So these are the most Casper and PA CAT are optional examinations. So it all helps you to get scholarships actually. A lot of scholarships are also available for students. So very nominal examinations, not great. Panse examination is licensing examination. After clearing the PA, you will be having even the Panse examination, licensing examination. The passing ratio is 95%.
I had attended earlier session. I want to ask, what is the basic amount of funds required to start PA program initially?
Initially, basically, per credit, if you want to take it on online, prerequisites are there. So you can around $400 to $600 is a per credit charges are there. So you can start with two subjects at a time, and that much fees you will be paying to the university. If you want to go for offline, so offline you can directly fly down to the US for the prerequisite part also. And there are two. As I told, two programs are there. You can take prerequisites in India, 1 year full-time prerequisites in India, or you can take prerequisites in US also. So the cost will be at around $1,200 to $1,500 per credit. So around 30 to 32 credits are there, which needed to be completed. So if you are doing it from India, you are saving lot of money. Lot of money if you are saving it in India. But if you are comfortable with offline trainings and all that, you can go to the US and no issues at all. So you can start with two subjects at a time. Total budget, I will say ki total PA cost is at around $30,000 to $50,000 is a normal like any other masters. Typically $30,000 to $50,000 is a per year fee. But with your good profile, lot of students are getting good scholarships depending on your academic and non-academic profile and good GRE score and all that, and early applications, good PA interviews, and many. Even if you are not getting the scholarship during your PA, I always suggest student to start with the research activity there. You start assisting research there. Take the research assistantship with the. Most of the students are doing that, teacher assistantship or research. So they are getting great scholarships. But without scholarship, anyway, $30,000 to $50,000 per annum, a 2 years program or 2.5 years program can be there. So it anyway between 60 lakhs to around 1 crore can be the total expenditure for the PE program. You can take it without scholarship. I am telling you, depending on where you are applying, where you are getting the admits and all that. Lot of bank loans are also available. So you pay the initial and then you can do lot of student jobs there where you are earning your complete money, 20 hours in a week. Secondly, optional practical trainings means on the F1 visa in the residency you will be going on a J1 visa or H1B visa in the residency program. As far as this program is concerned, PA, you will be going on a typical F1 visa there. So since you are a STEM student, science, technology, engineering, mathematics, So you are eligible to take 3 years of OPT, optional practical training. So you will be having multiple options for the H1B visas. The hospitals will be paying you good salaries. Around 1 crore rupees per year is the basic minimum salary to start with for the physician associates. So you can repay the complete loan amount and all that. Yes. Any other questions? Please, Varsha ji.
No more question in chat box now.
Anybody wants to ask?
Good evening, sir.
Good evening, Kalyan.
This is Dr. Kalyan. Yeah, thank you for motivating us and guiding us. So, I have completed my rotations in USA, 5 months of rotations, and I have completed my step 1. Now I am preparing for step 2. So, how will you guide me, sir? Any research
So
opportunities,
basically,
anything
Kalyan
like
ji,
that?
it will
Yeah.
be fine if you can, it will be really great if you can share your complete profile with us. That is the
Okay.
first thing. So we can help
Okay.
you with the complete admission process.
Okay.
And secondly, you research. What part of research have you done? I don't know. So I will really like to evaluate with the US guides your research part and your academic profile part. Just clearing the USMLE, and always one more caution is there. Evaluate your mock test results before giving the USMLE step.
Yeah, definitely, sir. Sure.
So that is very, very important. We can help you with that, with USMLE mentoring for that. Secondly, we will evaluate your research profile, academic, non-academic profile. We can set up expectations for you according to that is a set of setting the expectations as per the residency requirement. That
Yes,
parameters can be completed. We can guide you for the one research big project, and then if you are secondly, we can completely strategize and we can handle your complete match and soak process. We can also give you training for the residency interviews. So we can help you with that. So I will surely like to have your profile with us for the evaluation, and then we can have one-to-one discussion. And I will also like to, at that time after evaluation, I will also like to call, I can call somebody, residency expert from the US for one-to-one conversation with you. That will be also great, because already you have covered all this, but these are certain tips which I give.
yes, sir. Yes, sir. Yeah. Thank you, doctor. I will
Because
share my profile.
identification of the program is so critical. Where you are applying and how many programs you are applying, what flexibility you are having. So that is the thing of getting into the residency, plus with good profile. So please share it with us.
Okay, doctor. Thank you. Sure.
Thank you. Any more questions? Yes, Jayesh bhai. You can unmute yourself, Jayesh.
कैन आई स्पीक सर हिंदी?
हाँ बोलिए ना सर, बहुत अच्छा लगेगा।
सर मेरा सन अभी जॉर्जिया फर्स्ट सेमेस्टर कंप्लीट किया है एमबीबीएस
2000
अभी जस्ट फर्स्ट सेमेस्टर ही कंप्लीट किया है उसने अभी सेकंड सेमेस्टर में।
आपके बच्चे ने कंप्लीट किया बस।
हाँ जी सर, और उसका प्लानिंग है आगे यूएसए का।
तो फर्स्ट ईयर
तो उसको आगे करने के फ्यूचर में अभी क्या क्या तैयारी करना है, तो आप कुछ गाइडलाइंस दे।
बेसिक रहता है कि फर्स्ट ईयर जो रहता है ना, फर्स्ट ईयर इज ऑल अबाउट टेकिंग अ नॉन क्लिनिकल अप्रोच, नॉन क्लिनिकल रिसर्च, और इसके लिए बहुत अच्छा रहता है फर्स्ट ईयर से। हमने जितना हम हमारा प्रोफाइल देखिए, फर्स्ट ईयर में भी कोई अपना प्रोफाइल बिल्डअप चालू करता है तो फाइनल ईयर में निकल तक उसके 5-6 रिसर्च पेपर पब्लिश हो जाते हैं।
ओके,
उसका ज्यादा अच्छा बेटर प्रोफाइल हो जाता है। तो ये सब प्रोफाइल बिल्डअप एक्टिविटीज वगैरह फर्स्ट ईयर से शुरू कर सकता है वो। बहुत अच्छा। तो नॉमिनल उसके सेशंस होंगे, वो सेशंस वाइज उसको गाइड्स 3-3 महीने के उसको सेशंस बताएंगे कि क्या क्या करना है, और उसके लेवल के हिसाब से रिसर्च, ये एकेडमिक रिसर्च रहना जरूरी नहीं होता, नॉन एकेडमिक भी रिसर्च होता है। जैसे मैंने आपको एग्जांपल भी दिया है, इट इज, हमें लगता है कि रिसर्च बोले तो कुछ तो भी मैं नया मॉलिक्यूल ढूंढ के निकालूंगा और उसको ऐसा नहीं रहता है। तुम्हारी लेवल के हिसाब से रिसर्च एक्सपेक्ट है। इट इज ऑल अबाउट योर एटीट्यूड। सो ये सारी चीजें फर्स्ट ईयर से यदि हम शुरू करते हैं या तो बहुत ही अच्छा है, क्रूशियल, बहुत अच्छी चीज रहेगी उसके लिए। तो उसको ज्यादा समय मिलेगा, छोटी छोटी चीजें करते करते उसका प्रोफाइल बहुत अच्छा हो जाएगा। तो आप उसको लेके एक बार मेरे साथ सेशन करना, तो उसके साथ
Okay.
फिर मैं थोड़ी बात करके फिर बहुत सारी चीजें बताऊंगा, तो वी कैन देन डिसाइड, वी कैन अगेन सजेस्ट सर्टेन प्रोग्राम्स फॉर हिम, फॉर द फर्स्ट ईयर स्टूडेंट, आफ्टर हैविंग अ डिस्कशन विद हिम, और फिर उसको प्रोग्राम में सजेस्ट करूंगा, तो अकॉर्डिंगली ही कैन स्टार्ट विद द कस्टमाइज्ड प्लान फॉर हिम।
Okay.
सो उसको बहुत एक्टिव रहना चाहिए, उसको अलग अलग एक्टिविटीज करना चाहिए, यूट्यूब क्रिएशंस अपने अपने करना चाहिए, पार्टिसिपेशन हर इवेंट्स में उसका होना चाहिए, ये बहुत जरूरी होता है, विद गुड एकेडमिक रिकॉर्ड, ये बहुत जरूरी है, बहुत जरूरी होता है। यस,
Okay, sir. Thank you.
थैंक यू। हाँ, कुछ क्वेश्चंस? यस।
Mukul sir, this is Sushma. I have sent my profile to your email about last week, 2 weeks ago.
या ऑन मेल आई हैव गॉन थ्रू योर, सुषमा जी, मैंने
हाँ,
आपको,
sir.
आई इवैल्यूएटेड योर प्रोफाइल,
Okay.
so I'm just now I'm not recollecting, if you can just repeat your complete thing. I have an answer, I think I have given you the answer, I don't remember, but I evaluated your profile, please.
Sir, I mean, I am ECFME certified in 2006, and I am clinically active, worked in India and UK. I practiced internal medicine.
So ECFMG certified means have you cleared step 1, step 2, step 3 also?
Yes, sir.
All the 3 steps you have cleared, na?
Yes. Yes. So my exams are the old version based, but now I guess it is OSCE is being conducted, not.
So you have cleared that step 1, step 2 CS part also, step 2 CS and CK also.
Step 2 CS.
Everything.
So is that valid now?
Yeah, it is valid because you already cleared the step 3 now.
Yes.
So it is unlimited validity is there.
Okay. So how can I improve my profile? I mean, I'm not expecting high competitive specialties, but I want to apply for family medicine. And if I do not need a visa sponsorship, can I try for some small programs, community programs? So is that possible? And
see, 2-3 things are there. One is you can always go for the MPH, Master of Public Health, and all that programs. That is always available for you, healthcare management, but that is a non-clinical thing.
Yes.
One thing is that since you are a step 3 pass out, if you have some good research profile, projects and all that, you can try for the fellowships. You can always go for a small fellowship programs, that is for but if you have a goal to settle down in US.
Yes, I want to.
So I will suggest PA program for that case currently, because lot of gap is there from 2006. What were the marks in step 1, step 2, step 3?
Step 1 was, now it is pass or fail, but and then it is 245, and step 2 220, just passed. And step 3 200, just passed. I have seen yours, just
past examination. So what I will do now, again I will send it to Dr. Donald Martin in US, your profile.
Okay.
And I will have a one-to-one discussion with him. But looking at your this scores are on the lower side. Main hurdle is 2006. Lot of gap has gone. Residency, it seems difficult. So, but you will have to build up your really good profile, and you can apply simultaneously for the fellowship as well as the residency.
Okay, what fellowships can I try for? Like what?
NRMP fellowship. Free programs are there, na? NRMP.
I do not have a master's MD. I am.
No. See, if you are an MBBS graduate, you go on NRMP, you go to the ecfmg.org.
Okay.
And you go to the ecfmg.org and go to the fellowship programs.
Okay.
So fellowship means long-term 1-year program, 2-year fellowship programs, one international medical graduates who have completed USMLE step 1 and step 2. They can apply for the NR, similar to the residency. Fellowship programs are also there.
Okay.
But that will not give you license. But you will be into the fellowship there. That will be the paid. They will be paying you the amount and all that. So that will really improve your profile and all that.
Application. Yeah.
So that is also available for you. But for that, your research profile should be there. After 2006, what activities have you done and all that. You should build up that profile.
Okay. Okay.
That
So,
is or best way is to, if you are comfortable enough, you directly go to the PA program. You start with the PA program and all that, and that you enter into the US. Anyway, you are earning whatever after so much of work in so many years. Whatever payments you are getting here, they are negligible payments. So in PA program, we really give you the very good opportunity for the family medicine and all that. You can practice there, you can have license, and then residency can really open up for you because already you are a PA there.
okay. Okay, sir. Is it possible by doing research and having some publications done and strengthening the profile? Will that be helpful?
Yeah. Not required more for PA. You need to start with the prerequisites. That for residency or for the fellowship programs, you need all these things.
Publications and all will help.
All that will help you for the residency part or for the fellowship part. For PA, you will have to score good marks in the prerequisites. We will have to start with the prerequisites.
Okay.
Though you are ECFMG certified, but we will do the WS evaluation, and WS evaluation के बाद में हो सकता है कि आपको without prerequisites भी PA मिल जाए.
Okay.
We will evaluate that.
Okay.
Because you have cleared the step 1, step 2, step 3. But only thing is that you have done your graduation way back 18, almost 18 years back. So that is the major thing.
Yes. Yeah, that's what I see. I mean, most of the programs, they have a requirement of 10-year minimum graduation.
Minimum, yes.
So in that case,
more than 5 years, it is always difficult.
Always.
So, yeah. But PA is, you can surely go into the PA. No issues at all. You can enter into the US with PA.
So residency is impossible for me now?
No, I'm not saying impossible. I'm not saying impossible. It is difficult. It is difficult. It is not impossible. We will have to really build up your profile, and we have to apply very, very strategically to do multiple programs. To the NRMP fellowship programs.
Just now, madam told about the thing about the long gap, right? And last time also I had a talk with you. I too also have a long gap. So that,
I remember.
You remember? Okay, yeah. So yeah, the case was different. So yeah, I've been in touch with Pranali and for some time. So again, the same thing, about starting the PA. I was the one who asked about the basic initial funds which is required. But my very keen interest, again, like it was earlier, is that if we enter a PA program in say a surgical field and work there for do the credit hours as whatever you said, of 2-year training, does that actually open our doors to getting into surgical residency? And you just said it is extremely difficult, but you have to define the various parameters of what extremely difficult means. So
basically, see, one thing is that I should be very, very genuine with my opinion. One thing is that a lot of gap is there into the state. If you will go to all the websites or all the bulletins published by them or all the information or all the data, you will find that more than 5 years gap is not a desired by the programs, most of the programs. So even for the PA program, why they are asking you to do the prerequisites? You should understand this factor. So what happens if you do you are already a MBBS graduate. See, anybody from the Ayurveda or anybody from the BHMS, he cannot do the residency part. He cannot do the residency part. He will go into the PA, and after that he can do the PA residency, not the medical residency. He can do the PA residency or PhD and all that. So generally you enter into the PA, you take up the specialization of the first year is common. After that, you take up the specialization there. You enter into the surgical thing. You give the PANSE examination. You get yourself registered as a physician associate in the surgery, general surgery and all that. So you generally PAs work with the contract on a agreement contract basis with the senior physician. Every state has their own policies where you are working for at least 3 years with the physician and all that. In the surgeries, and you are doing all the minor surgeries. If some major surgery is there, you will be in the team with the physician. That is the difference. But all the minor surgeries, suppose orthopedic surgeon is there, so all the fractures or minor surgeries are managed by the orthopedic PA. But if the knee replacement surgery is there or hip replacement surgery is there, it will be managed by the physician in coordination with the PAs. That is the difference into that. But all the preliminary diagnosis, everything you are giving. So once you enter into the PA and you have the clinical exposure in US, automatically your profile gap, whatever gap is created in India, that gap, we can fill up that gap in the US. In the PA, you can have enough clinical exposure, and after that, it will be really create an opportunity for you to go into the residency programs also. So simultaneously, you do the step 1, step 2 examination during your PA. Do good research. You give the USMLE step 1, step 2, and then enter into the residency. Because ultimately, when you are going to the PA program in USA, you are spending lot of amount. Secondly, you should be financial secured also now. So with PA, your risk will be minimum. Already you will be having one license with you, one job with you, and your profile will be upgraded, and then the chances into going into the residency will be more. If you will directly apply for the residency, I am not saying it is difficult. I am saying that give USMLE step 1, step 2, and step 3 with excellent marks. Step 1 is anyway pass and fail. Score 250 plus marks in the step 2, and give the step 3 examination also, clear with good marks. Build up your excellent profile and everything, and then apply to the 2025 match. Time is also very crucial for you, because it is not practical for you to apply for the 2024 match. It is not at all practical for you, because your profile is not updated. Till now you have not given the step 1, step 2. So when you are going to prepare for the step 1, after that you will be taking the rotations, after that you will be taking the letter of recommendation, doing the research and all that. So anyways, 2024 is really difficult for you. It is not practical for you. So you will be giving it 2025. You have to complete these parameters and then go for the 2025. But if your dream is there to go to the US and settle down and everything and keep the options open, so why you are thinking that PA is an inferior thing? In India, you are doing DCH. In India, you are doing DGO. You are okay with it if you are not. Many people are going for the community medicine or pharmacology and non-clinical branches. But in US, which is rated as a #1 job, you are not ready to go for it because you are feeling that no, it is an inferior job for me. Absolutely not. So it is all about practical decision. It is all about strategical decision. With my current scenario, what has to be done? So I have told you clearly, if you want to go for residency, chances are difficult because your gap is more. So you have to create your great profile with all these 3 examinations. You need to clear with great marks, and then you apply for that. No issues at all. But second, that much risk you will have to, time you need to invest, that much investment you have to do for that, trying for that and all that. But second is, immediately you start with that. Next year you fly down to US. In 2024, start your PA program. Get in within 2 years, get a license to practice there. Start earning 1 crore rupees per year. Simultaneously, during your PA, build up your research, do the research profile and all that. Give the USMLE step 1, step 2, and keep the residency option open for you.
Okay, sir. Yeah, I got it. Yeah. So you would still say that getting or choosing the PA program pathway would be a more wiser way to go.
Wiser way, considering your profile, your present status.
Yeah. I get
नहीं
it.
तो तुमको शर्मा जी 2025 में आप अप्लाई करोगे सितंबर में और 2026 में आपकी रेसिडेंसी चालू होगी जून महीने में.
Sure.
तो अभी
Okay,
और
sir.
3 साल चले गए, आपके 2 साल चले जाएंगे फिर उसके.
Sure.
तो वो करने
Okay,
की
sir.
तैयारी है तो लग जाओ उसके ऊपर और उतना फिर रिस्क लो कि नहीं मैं 500 यूनिवर्सिटी में एप्लीकेशन करूंगा. आई विल अप्लाई टू द 500 यूनिवर्सिटीज. आई विल अप्लाई टू दिस, आई विल बिल्ड अप दिस, आई विल स्पेंड दिस मच ऑफ मनी. फिर वो प्रिपरेशन रहना चाहिए. आप एक्शन नहीं लोगे किसी भी चीज की और केवल ख्याल सोचते रहोगे तो कुछ भी नहीं होने वाला. The basic thing is action is missing.
Yeah. No, that was there. I think we had the session in August or something. So
Yeah,
there were other things which were prior commitments. So because of that, so I'm actually on the basis of what you have told, I think I will opt for the PA program because that will give me definite guarantee of at least entering and staying there in the US.
Yeah.
So that may help me. Okay.
Yeah.
Okay, fine. I'll get back to Pranali with my thing.
Sure.
Okay, thank you, sir.
Sir,
Yes, Sushma ji.
sir, are there realistically programs which accept old graduates, family medicine programs available? I mean, because I see that, they have started so many new family medicine programs because of the shortage of primary care physicians in US.
You are not audible. You are not audible.
అంత దూరం కష్టపడి పోతే కేసులతో బిజీగా ఉన్నారు ఎక్కువసేపు మాట్లాడలే.
Hello, can you hear me, sir?
Yes.
Yeah. No, I mean, ACGME has started so many family medicine residency programs, new programs, small community programs.
Yeah.
So, are they accepting old graduates at all? Like,
I'm not saying that they are not accepting. I'm telling that the percentage is less.
Okay.
So one thing is that Sushma ji, you apply for, you can, since you have cleared the step 1, step 2, step 3 already, you can apply for the 2024 match. But what is your research profile, non-academic, academic profile you need to build up.
Okay.
You should have some publications and all that. So you try with the application, no issues at all. So you apply to the family medicine program.
Okay.
And you also apply for the research fellowship programs there. That's what my comment is.
Okay. So,
but it is not a guaranteed thing. I cannot give you the guarantee for that.
Okay. So, what fellowships can I target if I am looking at family medicine, like geriatrics?
So we will evaluate. We will have the special discussion for that. We can have one-to-one discussion. You for your first thing is that my gentle suggestion for you is that you go to the this ECFMG first today.
Okay.
You go to the fellowship programs.
Okay.
And also visit the NRMP thing. And what are the programs? There is a complete details of programs is given in that.
Okay.
Everything is mentioned there. So you go into that, you will understand, and then we will have the discussion. That will be really very fruitful.
All right, sir.
Yes.
I'll get back to you.
Yes, surely. We should connect. And if you are serious, we have to take it to certain direction.
Yeah, sure.
Yeah,
thanks.
Okay, so okay, I'm available for all of you for the consultation part.
One more question is there actually. Does a long gap doctor get admission in surgical residency or get into surgical fellowship?
See, basically, many times there are two types. One is preliminary year and one is categorical year. So, depending on your profile again, and I will also like to tell you, on the recommendations also the residency happens. It is not that everybody goes through the NRMP and gets the residency. If you are into a fellowship program, suppose, and if the guide feels or that hospital feels you are fit up for that, they can offer you the residency program. It is not that. So basically, it all depends. So preliminary year is that they will observe you for that. Whether you have the skills for that 1 year and all that, and then categorical year, second year they will offer you the categorical. Generally, in surgery, they are very, very cautious about the general surgery part. And since you have a long gap, but your work experience will also have some value. That is not that whatever work you have done and all that. So that you need to showcase it in a proper manner. Take some good, excellent marks in the step 1, step 2, step 3 and all that. And then try for the program applications and all that. But percentage is less. Surely percentage is less. Yes. Hello. So, okay. So I think the questions are finished.
Sir, I have shared the feedback form of webinar. Please, you can mention them.
So my gentle request to everybody put their comments on the webinar. What do you think about the webinar, so that we can also improve. I can also improve my interaction and my on what aspects and all that. So
have you shared
please.
on WhatsApp?
Yes, I have shared the feedback form
on WhatsApp.
Yes.
Okay, so thank you, everybody. Good night. Wishing you a pretty happy Diwali and Deepavali to all. Everybody careers should be like diyas. And wish you great health ahead, great family time, and great professional success. Thank you. Vande Mataram. Thank you.
Thank you.